The number of coronavirus cases in Massachusetts continues on a downward trend. But as the state continues to reopen, what activities are safe to do this summer in the midst of COVID-19? Carolee McGrath spoke with the chief of Infectious Diseases Division at Baystate Medical Center to find out more.
I think things look pretty good. I think Governor Baker and his administration is doing this carefully in a phased fashion and basing it on real data in the state. And I think that's a very careful approach.
So all the trends seem to be going down, which is exactly what you had just mentioned. Deaths, the number of deaths trending down, number of cases trending down as well, all as a result of the measures that were put in place?
Yes, absolutely. I think, as I mentioned before, we all did very well in terms of responding to this pandemic. The cases are really down and we're past the surge.
Are you concerned when you look at other parts of the country, especially some of the states in the South? There's Texas, Florida, even California, kind of pulling back from some of the reopening plans that they have after seeing some surges.
Yes, and I think that really can cause a lot of concern, especially if you're going to have an interstate travel as well. But I think based on the poll that I've seen in terms of the community looking at reopening, people in general very, very careful in terms of going back to the pre-COVID activities. So in that means that people are more careful than other places where they just jump right in and doing what they were doing before the pandemic. And of course, knowing that there are increasing cases in other states, it's true that if you don't follow some of those preventive measures, that you can get into trouble, and we may get into trouble in terms of having another wave of infections.
Is that something that you're concerned about? Because I know a lot of people are looking ahead to the fall and wondering what school's going to look like, wondering what colleges are going to do. Some of them have their plans. Is that something that could happen, that there'd be another wave?
Yeah, it's a potential thing that can happen. But as I said, if the community, we work as a team in terms of following all the guidelines that was set by the state in terms of preventing new infections, I think we should be able to go back in a careful and a safe fashion. Because we have to do what we have to do, but at the same time, we need to know how to protect ourselves. And this is probably going to be not only this year, probably next year as well, until such time that we have a full understanding of the virus, its implications, and the way we're going to have to live with the virus.
So when you say next year as well, we're talking about maintaining that social distance and wearing a mask, those types of new normal that the governor keeps talking about?
Yes, and this is considering all what we know so far and what we predict that we're going to have. For example, the vaccine. There's been some news that it may be available at the end of the year, maybe early next year, but getting it to everyone, those particularly at risk of more severe complications, the infections. But and then there's this question about reinfection and how much immunity and how long it's going to last after you got infection. So those still are unanswered questions, and so it's really hard to predict. But because of that, I think that the way we're going to be living our lives will be kind of similar this year as well as next year.
So some people, obviously, it's been a long time for this new sort of way that we've been living, are frustrated and have said, listen, the social distancing and the shutdown was to make sure that hospitals weren't overwhelmed. It looks like that has been accomplished. When can we start letting our guard down?
Yeah, and I can see that point because, there are things that because of this pandemic, things that you used to do, you're not able to do. And especially there are businesses that have been affected by this change in the way we do things. But in this regard, when we set all those measures, the rate of infection has come down significantly, and now the rate of infection now is very low, and the prevalence rate is low in the state. Uh, Now, restarting the activities that you used to do, in my opinion, as long as you follow those preventive measures of physical distancing of 6 feet, wearing face coverings, washing your hands frequently, at least 20 seconds, and cleaning the most commonly touched surfaces, I think it's reasonably safe to do the things that you've been doing. And again, we're doing this in a phased fashion based on what the state and Department of Public Health support. And as we go on with our lives, we will know better, and we will be able to deal with this situation and increase our activities as we move along and learn how to live with the virus.
And when you look at the activities for the summertime, especially with the cases now lower, you have swimming. Kids are able to go to a pond or to the beach. There's some sports practices that have been able to resume, at those socially distanced ways that they're carrying that on. Are there things that parents should be watching out for or concerned as they try to let their kids get out this summer?
Yeah. So, in addition to the commonly, mentioned risks of summer activities, including tick bites, don't forget about that. Tick-borne illnesses, we're still at risk of that this summertime. And we have this COVID-19 that we also have to think about. One common question I get is about transmission of COVID-19 while in a public beach or in a pool. So in terms of social distancing, we still follow those rules. Primarily, the infection is through respiratory route, droplets. And so that means 6 feet is still the guide in terms of physical distancing. In terms of the pool water or the beach water, or the pool water in particular, where it's disinfected with chlorine, there is no evidence yet that it can transmit the virus. There's never been a report, a case of that. And we believe that the chlorine in the pool should be able to inactivate the virus. And so it's relatively safe. And so that means you don't really need to wear a mask while in the pool, in pool water. So, and of course, if you're outside of the water area and you cannot do physical distancing, then you have to wear the mask or face covering. And if you look at the CDC website as well, they mention about being being in the same household, individuals in the same household is low risk compared to if you will be mingling with other people from another household or another community.
So will the recommendation remain that if you're going to be getting together with other people, as most people I think up until this point really haven't been doing, you got to keep a mask on, maybe do things outside? Or is it that you can start having birthday parties at some point by the end of the summer?
The risk is lower if you're still going to be in the same household, the same community where the level of infection is low, the rate is low of infection. That means the risk of having one individual being infected and spread it is low, just in general. So so being with other people who are from the same community or same household, for example, is pretty much low. Now, if you have other people coming from different communities where you don't know the situation, then there is potentially a higher risk of having an infection, especially coming from, let's say, out of state where there's an increased risk of, there's an increased level of infections. So, and going back to your question, yes, I mean, we still need to follow those rules. You can still enjoy your outdoor activities. Outdoor is less risk or carries less risk compared to indoor activities where the air is not well ventilated. You can still enjoy those activities.